Ignore your prostate after 60, and you'll be draining your bladder through a tube into a bag strapped to your leg. According to Dr. Barbara Oneill, these 5 fruits prevent that nightmare. Number 1 works in 48 hours. Today I want to talk straight to you. No fluff, no jargon, about real foods that fight prostate enlargement and inflammation, foods you can add to your plate starting tonight. Men often tolerate symptoms until they get unbearable. Waking every hour, that sudden urgency, the fear of not making it to a bathroom. That fear is real, and so is the solution. Over the next 10 minutes I'll walk you through 5 fruits with science-backed benefits, how to use them, exact portions, one quick trick that can produce a noticeable change fast. Think of this as a fear-to-relief roadmap. We name the nightmare, then hand you practical evidence-based tools. You don't need supplements or prescriptions to start, just knowledge, a grocery list. Stay with me because by the end you'll have a simple daily routine to protect your prostate and reclaim your nights. Listen carefully, watermelon is more than a summer treat. It's a natural source of lycopene and citrulline, compounds that reduce inflammation and improve blood flow. Lycopene is the same pigment linked to lower prostate cancer risk in multiple studies, and citrulline helps relax blood vessels and reduce pressure around the bladder outlet. Harvard and other research groups have pointed to lycopene-rich diets correlating with better prostate health. That doesn't mean a single bite solves everything, but a daily slice makes a measurable difference when combined with a healthy lifestyle. I recommend 1 slice of watermelon every day, a simple, repeatable habit. The mechanism matters. Lycopene operates as an antioxidant inside prostate tissue, quenching oxidative damage that fuels enlargement and irritation. Citrulline converts to arginine, then nitric oxide, which helps smooth muscle relaxation. That's one reason you might feel less urgency and fewer nighttime trips. When you choose watermelon, pick a firm, heavy fruit with a deep color and a hollow sound when you tap it. Fresh matters, the compounds we're after peak when the fruit is ripe. A single slice is easy to pack, easy to eat, and perfectly safe with most medications. Eat it in the afternoon or early evening, not right before bed, to allow the diuretic effect to settle. If you notice slightly increased nighttime urination at first, don't panic. It often normalizes as circulation improves and inflammation drops. This fruit also hydrates without the caffeine and additives of many drinks men rely on. Better hydration supports kidney function and reduces concentrated urine irritation that can worsen urgency. Try it for a week, and pay attention to how you sleep and how often you wake. Quick pause, please tap the like button to support more health videos. Pomegranate is a deep red superfruit and, medically speaking, a powerhouse. Hospitals sometimes restrict concentrated pomegranate products around certain prostate procedures because the compounds can interact with medications. That's how potent they are. That potency, in moderation, is what we can use to our advantage. A UCLA PSA study observed meaningful reductions in prostate-specific antigen when men drank pomegranate juice regularly. The active compound punicolagon is a polyphenol with strong anti-inflammatory and antioxidant action targeting prostate tissue. It reduces cellular stress and can slow enlargement and hyperactivity processes. I recommend an 8-ounce daily protocol, either fresh pomegranate juice or a serving of seeds. But caution, if you take blood-thinning medications or certain other drugs, check with your doctor. In practical terms, 8 ounces is a small glass of pure pomegranate juice, or half a cup of seeds, or 3/4 cup of seeds sprinkled over yogurt or oatmeal. It's easy to add and tastes vibrant. If whole fruit is hard to find, frozen arils or unsweetened bottled pomegranate juice are acceptable alternatives. Avoid added sugars. Fresh is best, but make it workable so you'll actually do it. You may notice improved urinary comfort within a few weeks, but punicolagon's anti-inflammatory effects build over time. Combine this habit with other recommended fruits for cumulative benefit. There's professional disagreement about dosage and clinical integration. I stand with evidence-based moderation, daily small servings rather than megadoses. If you experience stomach upset or medication interactions, stop and consult your clinician. For most men, the benefit-risk ratio is favorable when used sensibly and consistently. Tomatoes are a cornerstone of Mediterranean diets. Italian epidemiology links high tomato intake with lower prostate problems. The secret is lycopene. Cooked tomatoes with olive oil increase lycopene bioavailability dramatically. When tomatoes are cooked and combined with healthy fat, like extra virgin olive oil, lycopene becomes up to 500% more available for absorption compared to raw tomatoes. That's a game changer. This means spaghetti sauce, stewed tomatoes, and tomato-based soups are not only comforting, they're therapeutic. You don't need exotic supplements, you need the right preparation and consistency. I advise a concrete protocol. Eat cooked tomato dishes at least 3 times a week, like a simple marinara over whole grain pasta, roasted tomatoes with olive oil, or a tomato-based soup with vegetables. One study of Italian men who consumed frequent tomato products showed lower rates of prostate disease. Epidemiology doesn't prove causation, but combined with lab data on lycopene absorption, the case is compelling. Raw tomatoes are healthy, yes, but if you want targeted prostate benefits, prioritize cooked tomato-based meals with a drizzle of olive oil. Also, when you cook tomatoes with garlic, herbs, and vegetables, you get additional anti-inflammatory compounds that work synergistically. Food is medicine when prepared thoughtfully and repeatedly. Berries are tiny but mighty. Blueberries, strawberries, raspberries, blackberries are full of ellagic acid and anthocyanins, compounds that reduce oxidative stress and tame inflammation inside the prostate. Mechanistically, these polyphenols limit DNA damage, calm immune overreaction, and improve microvascular flow, which helps reduce both enlargement-related obstruction and the hyperactive signals that cause urgency. A large Ohio State analysis showed men with higher berry intake experienced about a 47% reduction in certain prostate-related risks. That's not trivial. Fresh or frozen, berries preserve most of their protective compounds, so don't worry if fresh produce isn't always available. I recommend 1 cup of berries daily. That's an attainable target whether you toss them into cereal, blend them in a smoothie, or snack on them straight from a bowl. Frozen berries are often picked at peak ripeness and flash frozen, locking in nutrients. They're convenient, affordable, and just as good for prostate benefits as fresh. Beyond antioxidants, berries provide fiber and stabilize blood sugars, both supportive of overall hormonal balance and prostate health. The synergy of nutrients in whole fruit outperforms isolated extracts in many cases. Add berries to plain yogurt, oatmeal, or mix them into salads, and for men who want variety, rotate types across the week to cover a broader range of polyphenols. If swallowing pills is your habit, consider this. Food-based polyphenols come with cofactors that help absorption and reduce side effects. Whole berries are a low-risk, high-reward daily habit. Watchful patients often report less urgency and a clearer stream within weeks of consistent berry intake combined with other dietary changes. Your mileage will vary, but the direction is promising. So set a simple rule: 1 cup of mixed berries every day. Make it tasty, make it habitual, and let the small fruit compound its benefits over time. Avocado is the final fruit on our list. It can give a noticeable effect in as little as 48 hours for some men. The key nutrient is beta-sitosterol. Beta-sitosterol blocks DHT conversion and eases urinary flow. Beta-sitosterol competitively inhibits enzymes tied to dihydrotestosterone activity. By lowering local DHT signaling, avocado-based diets can reduce swelling and relieve pressure on the urethra. Men report subjective improvement in flow and urgency rapidly, within a couple of days, in anecdotal reports. Individual responses vary, so best practice is a regular serving rather than a single large intake. I recommend a daily serving size, about 1/3 to 1/2 of a medium avocado per day. Or, roughly 2 to 3 tablespoons of mashed avocado. Use avocado in salads. Use avocado in smoothies. Use avocado on toast with olive oil. Use avocado blended into dressings. Pairing it with the other fruits on this list yields additive antioxidant effects. For a targeted 48-hour push, start with an avocado-based meal each day for 2 days. Stay hydrated. Reduce alcohol and caffeine that irritate the bladder. Monitor changes in urgency. For men on medications or with lipid concerns, avocados are generally safe and often beneficial for cholesterol. Make it practical. Keep ripe avocados on hand. Pre-slice or mash them for easy use. Pair with whole grains or vegetables to form balanced meals. So, add half an avocado to your daily routine. Watch for early improvements. This is the one I emphasize when men want both speed and safety. We started with a fear, the loss of control, the prison of constant bathroom trips, the specter of invasive solutions, and we end with a plan. 5 fruits you can use today: watermelon, pomegranate, tomatoes, berries, avocado, each targeting prostate health through different mechanisms. Antioxidants, anti-inflammatories, improved circulation. Start small and stay consistent. 1 slice of watermelon, an 8-ounce pomegranate serving, 3 cooked tomato meals per week, 1 cup of berries daily, half an avocado each day. Those are practical, evidence-forward steps that many men can follow. Combine them with hydration, reduced caffeine at night, reduced alcohol at night, and regular medical checkups. If you've been sitting on symptoms, consider this your wake-up call and your roadmap. Implement these habits, track your nights, talk to your doctor about how diet complements medical care, and, well, I'll be back with more practical tips, but for now, shop, prepare, and take that first bite toward reclaiming your sleep and your life.